Hello and welcome to Candid Conversation. Joining us today on our show is the Union Minister of Health, Mr. J.P. Nadda. So thank you so much for joining us. Sir, my first question to you is that what exactly is your plan to transform the healthcare system in India in the next 5 years?
You see, health is a subject which is basically a state subject. The policy orientation and the direction is to be given at the central level. So, according to my priorities, first of all, I would like to concentrate on the public health, and I would like to strengthen the public health system. Immunization is one area where we need to concentrate, and if the immunization process is complete and all the children get the immunization program, or they are involved in the immunization program, they get immunized, it is going to certainly help in the field of health, and public health area will be strengthened. That is what I feel. For this, we have also trying to demarcate the focus districts, which we have to, which are where the parameters, the health indicators are pretty low, which has to be taken into consideration. So those districts where the parameters or the health indicators are not very encouraging, we have to give them a special focus. For that, we are mapping the special districts, focus districts, and those focus districts will be given all types of financial, technical support which is needed, because there are gaps left in between. When the indicators, the health indicators of these districts are going to improve, the national indicators are going to improve. So that is one area which we would like to work. Another thing is that we would like to reduce the out-of-pocket expenses. For that, we have to see to it that our primary level health services and our secondary level health services, that has to be made more, that has to be strengthened, and we have to eliminate all types of gap in between.
You mean to say you're going to make health care system cheaper?
Yes, cheaper, meaningful, and affordable, accessible.
For everybody?
For everybody, accessible and affordable. And for that, we need to remove the gaps. So we have got public primary health center, got sub centers. But if we go there and if the patient gets the satisfaction and he gets all types of support and help, then only he is going to stay there. Otherwise, he is going to go into private clinic. One very ambitious program we have taken, that is Indradhanush. On the birthday of Bharat Ratna Shri Atal Bihari Vajpayee on 25th of December, we launched a program called as Indradhanush. There are approximately 90 lakh children who are left out, who are not being immunized. Out of them, 20 lakh children are there who have been partially immunized, who have been totally not immunized, and 70 lakh odd children are there who are partially immunized.
All these children you have already located them?
Yes, they are identified. The left outs. They are left outs. We in phases we are going to take this program. In the first phase, we are going to take few districts, 125 districts we are going to take. Where we have done the logistics, we have taken care of the logistics, how we are going to go forward. We are involving the public representatives also, and we are seeing to it. These are again from the focus districts or the districts where the parameters are too low or the health indicators are not very good. So they are these are the districts which we have taken. In phase 1, which we are going to do it from March to June, we are going to take these districts. We have mapped out, we have seen where the children leftovers are there, and we are going to launch this Indradhanush program. One more area is we say Swachh Bharat, Swasth Bharat.
Hygiene is a major problem in all the hospitals.
And as our Honorable Prime Minister has taken Swachhata as on the top priority, hospitals, medical institutions also need to be very clean, and Swachhata is much needed there. So we are formulating a program where public-private partnership or role of NGOs, that can be also taken into consideration, and we see to it that our institutions are Swachh, because if they are Swachh, then only they are Swasth. And for health, Swachhata is a very important factor. Hygiene is a very important factor.
So are you going to allocate any specific fund for this particular project of yours?
We have enough funds. Only the thing is that how do we make it the meaningful utilization of it. Funds, there is no dearth of funds.
Right.
There is enough fund. What we need is who
the roadmap you need to
who monitors
make,
it,
yeah.
who gets involved, how do we manage day-to-day basis, what are the inputs which are needed to see that these institutions are clean. We have got all systems in place. How does it work, and what inputs are to be given, how to fill in the gaps, that is to be taken care of.
Have you already started working
That we
on
have started. That we have started.
So this is one of the priorities.
Yes, this will come very soon, and we are going to roll out a program for it, and we are also going to come out with a policy how to we go forward. We will start with few institutions as a pilot project, and then go.
From where are you going to start the pilot project? Because look, we stay in Delhi, like AIIMS and Safdarjung hospitals.
I'll get back to you. At this point of time, I'll not be able to tell you, but we'll start a pilot project, and of course, Delhi will be one of the areas where we'll start.
Fine, sir.
IEC part, we are going to strengthen IEC part, information, education, and communication. That has to be taken care. That is one area which we are going to.
Can you elaborate on that, sir?
You see, what happens is that health. If you want to go for the preventive part, we have to concentrate on IEC.
Okay.
Health issues are first of all information, education, and communication.
Absolutely, that is
must.
That is
must
for awareness.
For awareness. Yeah. So what we are going to do, this IEC part, we are going to make it more meaningful, and more connected with the people, and more stress is to be given. A lot of funds are there. We need to have a better monitoring process. We need to see that it really works. We need to see that we really involve people in this program, and by their involvement, by involvement of organizations working in the health sectors, we can make it more meaningful. So that will be one area where I will be concentrating, where I am concentrating even now.
So it will be more of a digital thing also, information passing on?
Yes, it's digital bhi hoga, it will be digital also. But otherwise also by having seminars, workshops, interactions, this will be also one of the methodology which will be taken. Training part will be there.
Okay.
Training component is very important. We need trainers for it. We need people who have to be sensitized. First of all, the health workers are to be sensitized. Our people who are working in the health area, they are to be sensitized. Organizations working in health areas are to be sensitized. NGOs are to be sensitized. Right. So that is all which we have to do, and this we are going to do through digital also, through workshops, through interaction sessions, communication, having some field programs, so that all that will be taken care of. One area which I would like to concentrate is non-communicable disease, which is on increase. We have been fighting with communicable diseases, and a lot of programs have come for communicable diseases, but in course of time our burden has now doubled. It's communicable diseases also and non-communicable diseases also. Because of the lifestyles, because of the way of living, hypertension is on increase, diabetes is on increase, diabetes in the younger generation is on increase, cancer is on increase. So these are the areas which we would like to take care and we would like to address. And for that you need primary detection, you need sensitization, you need preventive strategy, and you also need tertiary care. So you have to have a very balanced approach and see to it that all levels this disease is addressed. So that will be one area where I would like to work, and we are going fast on it. Human resources has been really a problem for health department. At this point of time, we have got approximately 7 lakh doctors, approximately 14 plus lakh doctors are needed. So that is one area where we need some policy changes, and my predecessors have also taken a lot of initiative in it. The health ministry is aware of it, they are trying to do their best. But I would like to strategize it as this way, that all people who are involved in this health sector, keeping them involved, bringing them on board, especially organizations like IMA, Indian Medical Association, their suggestions are also to be taken into consideration, and we will go forward. Some policy changes may be needed.
So since you're pointing out this, I'll ask this question itself, like what is the reason why doctors, they don't want to go and work in villages, rather they prefer to work in the cities, and because of which we do not see that the clinics and the hospitals in villages, they are not upgraded, they do not have equipments. Are you going to make any policy?
You see, at this point of time, giving my observations will become a personal observation. So I would not like to give a personal observation, but there are certain things which we have to take into consideration. The medical education as it has gone, every MBBS student would like to go for post graduation.
Yes.
Now, if he has to go for a post graduation, he has to go forward in a hospital or a medical education. So, his going to the sub center, primary health center is something which he is not liking at the moment. Another thing is that we had the concept of general practitioners, that is on a decrease. Nobody wants to become a general practitioner.
You mean to say physicians?
Physicians. Where first we had the concept of family doctors.
Yes. Now they want to go for specialization.
Now everybody wants to go for specialization. So the doctors also want to do their post graduation. So there is a shift in the focus and in the strategy of the medical education. That has to be taken into consideration. But at the same time, the rural area, the primary health centers, that is the area of concern. So how do we strategize? That is one thing that needs some policy changes. But for that, I would like to bring all stakeholders on board, take their consent and go forward.
So you're working on it?
Yes, I'm working on it, and not only that, along with it, you see, we have been talking about medical colleges, but we are not talking about paramedics.
Yeah.
So it has to increase in the same ratio. So we have to take a very what I will say, that medical education needs to have a very deep thinking and at the same time a holistic approach.
Absolutely.
So with that we are going to do.
So you've been a minister for some time now. What are the key challenges you're facing as a minister?
Human resources is one of the very key challenge area which needs to be addressed. Policy of drugs, standardization, issues of generic drugs, standardization of the process of inspection of the drugs, the quality, all these are the areas which need much concentration.
So you are going, how are you?
I am trying to strengthen
Yeah.
our drug control policy. I am trying to strengthen it, equip them both with the testing facilities, with the inspection facilities, with the inputs which we get. It's such a huge area which needs more monitoring, and for more monitoring you need to strengthen your systems. And if you want to strengthen your systems, you need lab facilities, you need good scientists, you need good equipment, you need good human resources, you need people in place to monitor and to see to it. And also standardization is also a continuous process.
Right.
Drugs keep coming, new drugs keep coming in the market. So what is the process which they have developed? How have they gone forward? The standardization process is correct or not? After the standardization, they are maintaining the same standard or not? All these things need to be monitored.
So what efforts are you making to, I know you've spoken about it in the parliament also, but what efforts are you going to make to control H1N1 flu, because it has really widespread?
You see, at this point of time, what we are trying to see to it, that because the virus is activated and it is spreaded in far-flung areas, what we can do is first of all concentrate on IEC, see to it that maximum people come to our hospitals in time, provide them medicines, provide them all facilities which they need. At this point of time, this is what we are going to do. But at the same time, this is the strategy at this point of time to deal with the H1N1 virus. but very soon we have started working on it. We need to increase our testing facilities.
Okay. So that is one area you have identified as a problem.
We have started, and in very short span of time, we will be increasing our capacity of testing facility, labs facilities. For that, Government of India has certainly, every state should have one BSL 2 level of laboratory facilities that we are going to give. Financial allocation has been done, that will start having. We want that medical colleges should also have these facilities.
So that it becomes cheaper at the same time.
It becomes cheaper, accessible, affordable. And when you have such labs, then the education part also takes place. We will have workshops, interaction sessions. So in the interaction sessions, you are going to call the people, the stakeholders, the people who are advocating health issues, the people who are involved in the health sector. So IEC part will also take place, and what is the strategy which has to be developed, that will take place.
Okay.
So every state will have one lab, that is what we have thought, and for that the Government of India has allocated fund for it. We are very thankful to our Prime Minister Modi ji, who has taken care of it. It is allocated. Now we are going to roll out and see to it that every state has BSL level 2.
Right. So you've spoken about that medical treatment would be cheaper. Like as per the records, the report says that the pocket personal expenditure in India is over 75% of the total expense. In UK and US, it is less than 15%. So just not the poor, but overall, if we see that you're going to a private hospital, even a person who is earning quite a lot of money, say a lakh also in a month, for him also it's very expensive. So are you going to take care of everybody?
You see, people who want to go to the private sector, they will be going to the private sector. Yes. You can't stop that. But as far as our government system is concerned, if we keep it in place, if we give better delivery, certainly the number is going to increase, and satisfaction level is also going to be there.
So what is the status of our new AIIMS hospitals in different states, which we are expecting? 6
new AIIMS have come up. I took the review meeting of all these 6 AIIMS. They have started functioning. Funds have been allocated. I am regularly monitoring it, and very soon they will be working as a full-fledged AIIMS, and new AIIMS have also been declared in the last budget. Those AIIMS are also coming up. Very soon the project is to start. So
it will be at par with the Delhi AIIMS hospital that
an institution takes its own time to develop.
Right.
So, but the target is to bring it to the Delhi level. The buildings and the facilities to be given all are international standards, national standards.
Certainly, it will reduce the inflow of patients in Delhi, which is overburdened.
Yes, and I visited Raipur. I can see that people have now started going from Madhya Pradesh and from Chhattisgarh to Raipur, not coming to Delhi.
Right, that's a good thing.
The very same thing is going to happen in Madhya Pradesh when Bhopal AIIMS is going to come up.
So coming to corruption, what are your plans to curtail corruption in different hospitals? So especially in the government hospitals, we do see corruption is still prevailing.
You see, effective monitoring is needed. Message should go. Zero tolerance towards corruption should be there. Our system of monitoring should be effective. Action should not be delayed. We should view it as a very serious issue and address accordingly. I think that takes check of it.
So a proper monitoring system is going to be in place.
Yes.
To keep it, are you going to open any helplines specially for that, or how do you plan to?
We can think of that. We can think of
so that if a person has a complaint,
he
can
as far as the communication part is concerned and information part is concerned, whether a helpline or what other system we can develop, but certainly the information regarding these issues should flow in, and that system we can think of it.
So, Mr. Modi, he said that the Modi government plans to provide free drug and diagnostic treatment and insurance cover for the poor. So, how soon can we expect that?
To give them accessible, affordable health care
or maybe free if required be?
Accessible, affordable health care, and you see certain amount of drugs are going to be free. It's for the general public which we are going to do. So that will take care.
Sir, this recently we have seen that Beti Bachao Beti Padhao campaign has also started, and at the same time that ultrasound centers are mushrooming in different part of the states. How do you plan to control them? That's one of the major issues.
This
required.
is one of the very serious issues. Health department is very serious about it. We are trying to strategize it. We had some discussions. Some issues are there which needs to be addressed, related to legislative side, related to the methodology part. So which has to be answered.
So my last question to you is that the health ministry, how do you plan to avert another sterilization fiasco that happened in Chhattisgarh?
You see, as far as after the Chhattisgarh issue, we have issued advisory to the state governments. You see, these camps are done by state governments. We have advised them that all camps should be taken place in medical institutions itself. That advice has been in. And moreover, the states should be more cautious about it. They have to be very careful about it, and special attention is to be given in this direction. That is what we can do.
So thank you so much for talking to us.
It's a pleasure.